So today we are going to talk about withdrawal syndromes and a guide to see how different withdrawal syndromes like vary from each other or how you want to think differently about different ones. So let's start with alcohol withdrawal. The scale which we use is Siever's scores, and usually the timeline is 6 to 24 hours after the last drink. So any evaluation should always know last use and the modality of use. How did they use it? IV access or um, so modality. So did they use by oral, sniffing, IV, IM? How did they do it? So you want to understand that. In terms of alcohol, of course, it's oral. So onset is 5 to 6, 24 hours, 6 to 24 hours after last drink. It peaks at 24 to 72 and usually lasts for about a week. You want to monitor vitals. You want to monitor for tremors and seizures, any perceptual disturbances which would indicate delirium, and monitor the mental status in general. Benzodiazepines are used. Usually you want to think about lorazepam, oxazepam, temazepam a lot. These medications because they bypass the liver, and in alcohol you want to try to maintain this like that. Sometimes you use Librium, thiamine used, and IV fluids and quiet and well-lit environment. Now let's move to opioid withdrawal. This is after last use. Onset is 8 to 24 hours. Peaks between 36 to 24, last about 10 days. Again, vital signs, gastrointestinal symptoms, muscle aches, any cravings, and you're using COWS score here, COWS, and that is COWS score for opiates. You can use opioid protocol or you can use Suboxone, clonidine for autonomic control, blood pressure issues, antiemetics. Now let's move to benzodiazepines. You're using Siva benzos as a scale. Usually last use after onset is 1 to 7 days, peaks in 2 to 14 days, lasts about weeks or months. Seizure activity is something you want to think about, sleep disturbance, anxiety, vital signs. You want to try long-acting benzos such as diazepam, and then you can also use Neurontin or Depakote. In our practice, we use a lot of Neurontin, like 600 TID 4 times a day, or 800 4 times a day, or 3 times a day, and also use Depakote when possible. Then, when you think about stimulant, there is not significant withdrawal, but usually onset is in hours, and then you have like suicidal thoughts, sleep issues, and cravings. Again, like they say supportive therapy. Sometimes if the patient is psychotic or something, after stimulants, I use Haldol or Zyprexa sometimes. So think about that. So it's always good to understand a broad scope of, okay, you know what, like if this drug is used, what is it? Sometimes you have multiple drugs being used, so you still want to understand. I have patients where you're taking alcohol withdrawal and also opiate. I try to use alcohol withdrawal protocol, but you add clonidine into it picture and things like that. So if you want to be mindful that you're not giving clonidine and then you're also giving benzo within the time frame. You want to give some gaps, like an hour or something. So you want to be mindful of that. Okay, thank you.